The HALO technology is a new tool that should be used in every primary caregiver's office, be it a family practitioner, nurse practitioner, or the OBGYN physician.
HALO is to be used as a screening method in asymptomatic patients. If we find atypia or atypical cells, we know we need to watch those women much more carefully and perhaps do other screening tests.
It's used to identify a high-risk patient. It's not used on high-risk patients. So this is a technology for everyone. The finding of ADH is probably one of the, if not the most significant risk factor that we know of.
All we're trying to accomplish is identify women who we need to screen more thoroughly and triage them through the primary care system, and ultimately, if they need a surgeon, they can see a surgeon.
We still need more tools to identify more closely who these patients are and who needs to be moved into a very high surveillance group, or who needs to be counseled on lifestyle changes, who needs additional imaging studies, etc.
There's a big difference between what the HALO can accomplish and what ductal lavage was aiming to do. In ductal lavage, that was used on women who we already knew were a high-risk population. So it didn't add much to do ductal lavage, and it wasn't very precise. They were having other tests, etc., done because they were high-risk women.
I think that most women want to know what their risk is. Most women want to know what they need to do to either prevent developing cancer, if that's possible, through some sort of medication, or to diagnose cancer at the absolute earliest stage. So I think that as physicians, we underestimate the strength of our patients, of the women who come in to our breast centers and into our offices, in terms of their ability to handle that knowledge.
The age group that we're looking at for this is the younger woman that actually today has no effective screening technology, save clinical examination and self-exam.
Primary care physicians and gynecologists are the ones who are really out there seeing women every year at their annual exam. That is the perfect time to identify women who are at high risk.
Where I think the HALO device really fits in is the future of diagnosis, of being able to diagnose breast cancer patients at the very start of the developing breast cancer, or even before a breast cancer has developed, in order to treat those patients and diagnose things very early without any intervention.
And we look at the HALO technology as being able to offer perhaps as significant a decrease in the incidence of mortality from breast cancer as the pap smear has done for cervical cancer.
With breast cancer, you can never be too safe.